Good evening, and welcome back to the Principles of Seven. And I'm your host, Dave Sharp. Good evening, Hastings Community Voice. Welcome, all of you. Tonight, I've got a couple of updates, and the most important being Dr. Copur. We'll save the best for last. The first update I'd like to give you is that I've kept a website stashed back that I use for some of the work that I do as an investigative journalist. And I'm going to start using that a little more here for Dr. Copur moving forward. So I want to make sure I give that to you and tell you how we can use that. There's a tip section that will get information directly to me. It's the fastest way to get information that you have. And later on in this recording, I'm going to ask that we send some more comments and more of your stories, but I will get to that. And that website is principlesofsevenmedia.com. principles, 7media.com. I just got done going in and I cleaned up some of the articles that I've written, and I've left a few on there that will be important going forward. But if you just use that to send more of your comments, that would be amazing. And I'll link that in the description of this video. I'll also link it in the post when I post this in Hastings Community Voice. And then we'll get right into Dr. Copur. And I want to start by reminding everyone why this group exists. It's not just about Dr. Copur. It's also about the Hastings community and using our voice. Hastings is who we serve, and the community is what we're about, and our voice is our tool. That's why we named it what we did. And it's not about attacking people, and it's not about hospital politics, and it's not about one side trying to win an argument. This is about the community, our voice, and being heard. And this is about cancer patients and our health care. It's about families and continuity of care and whether the Hastings community is being heard. As of right now, the petition supporting Dr. Copur and continuity of cancer care has nearly 1,100 signatures that are verified. In a community this size, that matters. Those are not just numbers on a screen. They're patients, their spouses, their children, their caregivers, nurses, friends, and community members saying, please don't make decisions about our cancer and health care without us. Over the last several weeks, I've taken formal steps to make sure Mary Lanning leadership and the Board of Trustees cannot say they were unaware of this community's concern. I've sent registered letters to the Board of Trustees, and I have that tracking, so I know they've received them. We did 2 rounds of those, and the correspondence has requested that leadership meet with the Hastings Community Voice Accountability Council and the public Along with those letters, I submitted what is now 90 pages of Facebook and petition comments from people supporting Dr. Copur and asking for stability, transparency, and continuity of care. Those comments aren't rumors and drama. They were voices of this community. Larry Podewitz has also stepped forward publicly. He published an article in Voice of the People in the Hastings Tribune. And he personally delivered a letter to the Morrison Cancer Center that he wrote to David Zechman. Larry has been trying, like many of us, to keep this focused on patients and cancer care. And today, Larry informed me that he received a call from David Zechman, the interim CEO of Mary Lanning. Larry reported to me that Mr. Zechman told him that he hoped Larry would still be a customer of Mary Lanning, but also stated that there was no chance Dr. Copur would be reinstated. And David Zechman stated to Larry that this was personal. And I want to be very careful with my words here because this is serious. Cancer patients are not customers. They're patients. They're human beings fighting for their lives. They're families, not consumers in some marketplace. They're people trying to survive the hardest season of their life. And if this issue is being treated as personal, then that explains exactly why the Hastings community must stay involved. Because I think Mr. Zechman needs to understand that continuity of cancer care is not personal. A doctor-patient relationship built over years with trust is not personal. And a petition with nearly 1,100 verified signatures is not personal. Patients asking whether they will be treated by permanent doctors that they trust or temporary outside coverage is not personal. This is public health, not personal health. This is rural health care. This is about community trust. I also want to make something else very clear. We're not asking Mary Lanning to make decisions based on emotions. We're asking for transparency, accountability, and a real conversation with this community. If the leadership at Mary Lanning believes Dr. Copur shouldn't return, then they need to explain why and explain how continuity of care is going to be protected and who will be providing coverage and whether it will be locum doctors and how long that coverage is going to last and what patients can expect. The Board of Trustees has received the community's concerns. We've made sure of that. They have received the comments. They have received formal requests to meet. The question now is whether they will sit down with the Hastings Community Accountability Council and address those issues responsibly. Larry, Dr. Copur, and I are going to be filming a longer video so the community can hear directly about the developments and the phone call with David Zechman. That discussion is going to stay focused on facts, patient care, and the future of oncology here in Hastings. And I wouldn't expect that Dr. Copur would be talking about the situation with Mary Lanning directly at this time. Tonight I'm going to ask everyone in this group to do 3 things. First, stay respectful. And I don't think it needs to be said. This group is really good about that. And we're not here to harass anyone. We're not here to threaten anyone. Unlike what was reported that David Zechman stated that this is personal, we're not going to make this personal. Second, and that's where the tip line and the website comes into play, keep documenting your stories. Hastings Community Voice, the tip line, let's keep those comments and stories about Dr. Copur and your concerns. Let's keep those coming. if Dr. Copur or the Morrison Cancer Center team has changed your life, if they've helped your family, they've given you hope, and more importantly, given you time, let's document that even more because your voice matters. And third, I'm going to ask that we remember what this is really about, and that is cancer care and health care belongs to the patients and families who depend on it in this community. Decisions that affect life and death care should not happen behind closed doors while the community is told to simply accept it. And our message is we're not going away. We're not going to be reckless, and we're not making threats. We're asking for what every community deserves: transparency, continuity, respect, accountability, and a seat at the table when health and cancer care is being reshaped. This is Hastings Community's Voice. And tonight our message is simple. Patients are not customers. Cancer care is not personal politics. And nearly 1,100 voices deserve to be heard. God bless you all. Please be good to one another. This has been Principles of Seven, and I've been your host, Dave Sharp. God bless all of you.